Welcome to UMCC Medical Consultant Connectors, where your health matters to us. Your knee is the largest joint in your body, built for both strength and movement. It's more than a simple hinge. It's a complex system of bones, cartilage, ligaments, and muscles working together. The femur, thigh bone, tibia, shin bone, and patella, kneecap, form the joint, with articular cartilage allowing smooth, pain-free motion. At the end of the femur are two rounded knobs, the femoral condyles, crucial for knee movement. In children, the growth plate at the end of the femur, called the distal femoral epiphysis, is still developing and more vulnerable to injury. Ligaments like the collateral and cruciate ligaments stabilize the knee and prevent unwanted movement. Muscles and tendons add further support, making the knee both strong and flexible. When any part of this system is injured, the entire joint can be affected. Understanding this anatomy is key to grasping how certain knee injuries, like fractures of the condyles or growth plate separations, can disrupt everyday life. In kids, the softer, weaker growth plate is especially at risk during sports or falls. Damage to these structures can lead to pain, instability, and long-term problems, if not treated properly. That's why knowing the basics of knee anatomy is the first step in understanding these injuries. Let's look closer at what happens when things go wrong. Scene transition. A femoral condyle fracture is a break in the rounded ends of the thigh bone. Serious because it affects the knee's main weight-bearing surface. These injuries often damage the cartilage, leading to pain and possible arthritis. In children, a similar injury is a separation of the distal femoral epiphysis, the growth plate, caused by trauma that forces the cartilage to slip or break. If not treated, this can affect leg growth, causing length differences or angulation. Both injuries usually result from significant force car accidents, falls, or sports impacts. In adults, high-energy trauma or osteoporosis are common causes. In kids, sports like football or gymnastics put the growth plate at risk. The same force that breaks bone in adults can separate the growth plate in children. Recognizing these injuries quickly is crucial for proper treatment. The main symptoms are intense knee pain, swelling, and an inability to walk or move the leg. The knee may look deformed, and bruising often appears within hours or days. Limited range of motion is common. Bending or straightening the knee may be impossible. If you suspect a serious knee injury, seek emergency care immediately. Doctors will examine the knee, check for swelling, deformity, and test blood flow and nerve function in the lower leg. X-rays are the first step to confirm the diagnosis and show the extent of the fracture or growth plate separation. For complex injuries, a CT scan may be needed for a detailed view. Early diagnosis is vital to prevent long-term complications. Quick action can make all the difference in recovery. Scene transition. Treatment depends on the severity and type of fracture. Minor stable fractures may be treated with a cast or brace and no weight bearing for several weeks, more common in children. Most cases, especially with displaced bone or joint involvement, require surgery to realign and secure the bones. This is called open reduction and internal fixation, using metal plates, screws, or pins. Rest and immobilization start the healing process, usually taking 6 to 12 weeks. Physical therapy is essential to restore movement and strength, beginning as soon as it's safe. Recovery is gradual. Rushing can lead to setbacks. Commitment to rehab is as important as the initial treatment. The goal, a pain-free, stable knee and a return to normal activities. Scene transition. Without proper treatment, these injuries can cause lasting problems. The biggest risk is post-traumatic arthritis if the joint surface doesn't heal smoothly. Stiffness and loss of motion are common if rehab is delayed or incomplete. In children, growth plate injuries can lead to leg length differences or angular deformities. Early diagnosis and a dedicated rehab program are essential for the best outcome. If you or your child has severe knee pain, swelling, and can't bear weight, don't wait. See a doctor immediately. Protecting the knee now means a healthier, more active future. Take knee injuries seriously. They demand prompt attention. End. UMCC, your ultimate medical consultants connectors.